Good afternoon, Minister. Good afternoon, Dr. Henry. The Seniors Advocate, BC Care Providers Association are both saying that rapid and regular testing of staff in long-term care would be a helpful tool to help contain and identify the growing number of outbreaks in long-term care. It's being done for hockey. It's being done in the film industry. Why isn't it being done in long-term care here in BC?
Yeah, so I saw that. There was reference to some of the rapid tests that have been we've received in small amounts here in the province and in the country. So the short answer is that the testing is not available in what they were describing. But the other part that we need to look at is where this has been done in other provinces. It is not a panacea. It is not what is going to solve our issue because the tests have faults and limitations. And you'd have to test everybody every day. And yes, they certainly do it in some sectors for short periods of time. But the yield and the volume of testing that would require is not at the point where it would be helpful for us instead of the regular screening that we are doing every day. And when we do have outbreaks, as you know, we do test asymptomatic workers as well as the residents in care homes and in long-term care and in the hospitals as needed. So, we have protocols that do work. These are challenging times. We don't yet have that type of a test that we could easily every day have somebody test. And I will note that, we've seen limitations of those even in places where they do it on a regular basis, including the NHL didn't have a problem, but certainly on some movie sets we've seen it in the United States in some situations too. So it's absolutely important, and we will be looking at it as we have the tools. We'll be using them as we can, but we are optimizing what we do have right now to try and prevent. And the other thing I think that's really, really important is the risk in our care homes is proportional to the risk in our communities, and we see that. And we have to be very mindful that we as healthcare workers need to watch what we are doing in the community so that we don't take on risk from some of the social interactions that we then take into work. And that's something right now we absolutely need to focus on.
Do you have a follow-up, Bon?
Yes, the stats today, 58 people dead in the last 10 days, and from what I've seen from BC Centre for Disease Control, about two-thirds of the deaths in BC from COVID-19 are long-term care residents. I keep hearing from long-term care residents who they say it's not us, it's not the visitors, it's got to be the staff. Doesn't the rate of the spread here and the death rate lend a sense of urgency to doing more than's being done?
You know what? I can't say that there is more that is more urgent to us than doing everything we can in our long-term care homes. And I'm not sure that I know of anything more that we can do. And it is absolutely staff and people who work in care homes that are the index case in many cases. But partly that is a bit of an anomaly because we have reduced so many visitors into long-term care. And when we look at that balance of the density of how many people go in and out of a care home, that's where risk comes in, and that's where risk in the community is reflected in care homes. We have put in orders across the province to address just that so that we can reduce the risk in our communities, and that in turn reduces the risk in our healthcare system.
I think just to say that the investment and the effort has been massive here, and in a comparative sense, one of the reasons, the principal reason, and it's embedded in what you said, Vaughn, that we have the lowest rates of mortality of equivalent jurisdictions. The jurisdictions 5 million or more in North America. I think there are 27 of them, and BC has by far the lowest rate of mortality in that group of jurisdictions, states, and provinces is because of the efforts being made in long-term care, which have been massive in terms of PPE, the single site order, and all the other measures that have been put in place. But also what we need now, I mean, what's very clear, and tell you, nothing is being spared in this regard. And I think, we feel it every day, because I don't think families in long-term care in BC really think very much about what's going on in Winnipeg or what's going on in Nova Scotia. I know our family doesn't, I know other families don't. So I appreciate that every single case, every single outbreak is of concern and of consequence and requires a massive response. And we would love it if there was a single or an easy response to that. There's not. I think the combination of measures that we put in place have been more effective than other places, but that doesn't mean the losses haven't been tremendous and that we don't feel them. Everyone working in the system feels them, and all the families feel them, and especially those who have lost loved ones feel them. So the effort will continue. There's not a day goes by when we don't talk about what more we could do to address the situation in long-term care, and we're going to continue to do that in every moment and every step. As Dr. Henry has said, let's talk about the use of rapid testing and so on, and it's been told to me and others, and people will note this, that places such as the White House used a lot of rapid testing as well, but it is not sufficient in itself and can cause its own problems because of the issues with the tests themselves that Dr. Henry has enumerated. So we're going to keep doing everything we can and take every piece of advice we can. I know the care providers provided a report this weekend that I've read through carefully. I obviously read in detail the Seniors Advocates report. Certainly in the areas in which they have specialty, we rely on them, and the areas where Dr. Henry and public health has specialty, we rely on public health.
Hi there, Dr. Henry. I'm wondering if there's any more detail that we can learn about how the virus is continuing to get into the care homes and hospitals given all of the restrictions in place.
Yeah, it is through people. This virus is spread through people. We can't always pinpoint, but very often it's when somebody doesn't recognize that they're ill, or in that period of time prior to showing symptoms. So that is the bottom line. We've put in measures that have made a huge difference, but as we get more transmission in our community, the probability that anybody who works in healthcare, and there's a lot of us, has the virus and may be infectious to others goes up. So it becomes more and more important that we use all of those layers of protection. If we could understand how we could detect people early, and this is our challenge with some of the tests. We had a lot of really high hopes for some of these rapid tests, but what they're showing is that period of time just before, where people are sometimes most infectious, just before they start to show symptoms, is also the period of time where the tests work least well. So we're in a bit of a conundrum right now about that. The other thing, of course, is that the tests that we have are all right now based on a nasopharyngeal swab, the rapid tests we do. So we're hoping that we can get some easier tests. People don't like having a nasopharyngeal swab every day, and that can be very challenging for people, and then they avoid it. So making sure that we're paying meticulous attention to our own risk, how we're feeling every day, but also the risk around us. So if anybody in our family has been exposed or has illness, we need to make sure that we're paying attention to that as well. And that can be a challenge in healthcare because we tend to be presenteeism. We go to work no matter what because people are depending on us. So we have that balance. Sometimes it's residents, sometimes it's staff, most often right now staff because residents aren't moving around as much. But it's a challenging situation for us, for sure.
Brent, do you have a follow-up?
Do we have documented cases of people showing up who are symptomatic and we only find out about it after it's too late?
Yes, absolutely. I mean, that is unfortunately the situation, that people don't recognize that they have symptoms, or they're at work in the 24 hours before their symptoms start. And this is why we have now moved as well to universal mask wearing in our healthcare settings. These are things that can help. Right now, as we're seeing increased transmission in communities, that's where mask wearing becomes more important. It may not have had as much of an incremental impact in the summer when our cases were low, but it does make a huge difference now. And that's the reason why we pivoted on the mask wearing as well in the community.